Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, January 8th, 2021. And this is our bi-weekly, every other day community update, or for right now, it's our COVID update. With the increase of COVID in Northeast Texas and Titus County and Mount Pleasant, we're continuing every other day just to give an update to the community on where we're at. So let's start with numbers, and let's just tell you where we're at today. We have 55 patients this afternoon at 1:30 in the hospital. 22 of them are COVID. 15 are on a COVID floor and 7 are in ICU. Our non-COVID ICU is still full. And when I walked over here a few minutes ago, we had 17 people still in our ER from this morning who've come in. So we're busy and we're full. Right now, we cap out about 24 rooms for COVID, and then we'll hold in the ER, hold in other places. But as you can tell, we're full and have maintained that the entire week. So want to look at from a numbers perspective, and this is going to go to the whole full screen with this one, and you'll see this is our TSA, which is Trauma Service Area. We're F, and that's Paris, Sulphur Springs, Texarkana, and Titus. As you can see, this is beds, percentage of staff beds that are COVID related. And you can see as of January 6th, which would have been Wednesday, we were at 21.32%. So the state has a 15% cutoff, a threshold. If you're at that for more than 7 days, you have to have certain restrictions in the community and in your hospitals in that region as well. There's over 200 counties in the state of Texas now that are above the 15%. There's only two trauma areas in West Texas that are not at this level. What that means, and you look at it for the last 7 days right there. On Tuesday, we were a little excited. When it went down, we're like, finally, after 5 or 6 days of it going up, it went down, but then again, Wednesday went right back up. And I expect it, from the numbers we saw yesterday, to increase on Thursday and then Friday as well. We follow this daily. Not only are we looking at our staffing from a Titus regional perspective, we look at our staffing across the region about other hospitals. And you can see yesterday, the 7th, we had 235 COVID hospital patients in this region. That is the highest number we've hit since this crisis started in March. You also will notice there was 66 COVID in ICU on Wednesday, and then with only 4 available. Well, there was 75 patients on Thursday with 3 available. So you can see other hospitals in the area, in addition to what TRMC is doing, is increasing their staffed ICU beds. They're adding staffed ICU beds to their health system just to meet the capacity that we've hit, not only in the individual hospitals, the region, and the state. Being above that 15%, we are restricted of some of the procedures we can do, and Titus Regional is following those guidelines. You are able to do some procedures that are outpatient that do not interfere with your treatment of COVID patients, but some of those procedures have to be delayed. We meet at 1:30 of every day with a bed commander who represents the medical staff, the nurse administration team to review the ER, to review the census, to review the procedures for the next 3 to 4 days and make decisions. So we're following the guidelines by the state to make sure we have the staffing, the PPE, and all the resources available to fight COVID in this area. The vaccine is going to be the big topic, and it still is. We did receive the first dose of 700, and all those were distributed in a timely fashion. We should be receiving the second dose for those 700 in the next few days. Hopefully, week 5 shipments will come out this weekend or Monday or Tuesday. Titus has asked for quite a bit for week 5 and week 6. I did submit a survey last night asking for the ability to do mass distribution in the region. So hopefully we'll have more information on Monday or Wednesday of next week of those doses that are coming to Titus, but maybe the opportunity for them to come to the region. I want to give a shout out to Chief McCrae. He has been working closely, him and Judge Lee have been working closely over the last few weeks with the disaster emergency groups in Texas, trying to get more vaccines in this area. So they're working. So I'm hoping the next 3 to 4 weeks they'll have the opportunity to announce something even bigger for the region. But I just want to give a shout out to him, all the work that he's done, and the city of Mount Pleasant, working with him and their resources, both fire, but sheriff, the police, their social media resources to get the word out and try and get that resources from the state. So look for it, hope to come and get that going. I would encourage you, though, to get on our wait list. If you go to Titus Regional Medical website, we've kind of changed it to make it easier for you. And as of today, you can see if you go to our website at Titus Regional TRMC.com, you can see COVID-19 waiting list. Click here. If you click on that, it'll take you to the wait list, and you can get on that. As we get information, whether it's from our hospital doses or other resources, we'll use that wait list to get information out there. So I would encourage you to go get your family members, get them on it, tell your friends, tell your enemies where it is. But I would encourage you to get on that wait list. It's a way that we can communicate to you and get that information. And if we are able to get the resources that we've requested from the state, whether it be the hospital or Northeast Texas from an emergency standpoint, we'll be able to use that reference. So go to TitusRegional.com and click on that first bar, and you'll go straight to the wait list. We still have on there with COVID-19 information. You can see about 3/4 of the way down that screen, you can see the button. If you want to get more information about COVID-19 and what's going on, you can go to the website and go to there. So please go to the website and get registered to be on that wait list. You know, one of the things we wanted to do is get information out there about the vaccine. I know I don't have it today. I can't tell you when we're going to get the vaccine, but we're trying to do all the preparation for when we get it. We have got a town hall meeting, virtual, scheduled for next Thursday night, January 14th at 5:30 to 6:30. It will be a Facebook Live. We'll have Dr. Stagg and Dr. DeLisi joining me for a town hall meeting to ask your questions. So set your calendars, set your clocks, join us for that Facebook Live. Send your questions in. If you have my email, email it to me. If you go to the website and Facebook, there's a link in there to get your questions, or join us at Facebook Live and ask your questions that night. But we're going to have an opportunity for an hour to talk to two doctors on our medical staff who are well-versed in COVID, but also well-versed in vaccines. And that's why we've asked these two docs to join us. They're on the outpatient side. We'll do some more things down the road with some inpatient. You've seen some interviews of our inpatient docs who are treating COVID, but wanted our outpatient, family practice, and pediatric docs to address vaccinations and the COVID-19 vaccines to get that information out there so you feel comfortable getting on that wait list. Also, want to make sure you're aware of allamericantesting.com. That website's there. They're still serving Northeast Texas and Mount Pleasant with their testing, so it's just across the street from the hospital. Go to their website. It's pretty easy to get registered. You take that confirmation, you go up there. I've heard all good things. My mom continues to use them and good things, and I register her and get her through there. So it's been a pretty good resource. So please encourage you to get tested. Our clinics, the family care centers, have been busy, and our ER has been full. But there's testing at all of our family care centers as well. But All American testing is an option. If you don't have any serious symptoms, go there, get tested for more of your contact tracing. If you have symptoms, I encourage you to contact your primary care physician, your family practice. Please don't wait. Even fever, the different symptoms that we have, the cough, loss of taste, loss of smell, and especially that fever and anything in your chest, do not wait. Just don't get tested. Schedule with your primary care physician because they need to get you on some medicine to treat it. The one thing I want to encourage people, even though I'm giving you numbers that show we're busy, I want you to understand 911 is a resource. The emergency room is a resource, and this hospital remains open to treat this community and to fight this crisis. Again, we'll be on Monday, Wednesdays, and Fridays for the next week or two as the numbers continue to rise and stay at that level. We want to get the information out and be transparent to the community. Thank you for everything you do. Thank you for your support of us. God bless.